South Korea is only a few days away from the start of its pandemic exit plan, known as Living with COVID-19. Health authorities have announced the final details of that plan, which will start next Monday, November 1st. Choi Min-jung reports.
Starting November 1st, South Korea will begin its three-step transition back to normal life. On Friday, Prime Minister Kim Boo-kyum announced the finalized details of the new scheme. For 4 weeks, all businesses, including restaurants and cafes, will now be able to operate 24 hours a day. But bars, clubs, and other nightlife entertainment facilities will have to close at midnight. Vaccine passes will also be required for people entering facilities deemed high risk, like fitness centers, bars, and singing rooms. Those who aren't vaccinated will need a negative PCR test taken 2 days before going to the venues. Limits on social gatherings have been lifted slightly as well. A maximum of 10 people can meet in the capital region, and elsewhere, 12 people can get together, regardless of vaccination status. However, groups at cafes and restaurants should contain no more than 4 unvaccinated members.
I couldn't meet my friends for a long time and forgot about many of them, so the new measures are nice. But I still think we have to be cautious.
A restaurant owner in Seoul was happy to hear the news.
From now on, vaccination rates will go up and restrictions will ease further. So I think business and sales will return to the way they used to be before the pandemic.
A health expert also believed the government is heading in the right direction, but had to remain cautious.
I think this is the right direction given that the number of fully vaccinated people is increasing fast. But when the recovery is carried out too fast, there is a possibility of an increase in the number of severe patients.
The new measure comes as South Korea reported 2,124 new cases on Friday, exceeding the 2,000 mark for the second day in a row. Officials say the recent spike is mostly due to people becoming more complacent in regards to prevention measures. However, the Korea Medical Association says the number of infections could soar to 20,000 a day once the country transitions to living with COVID-19. They also added that the cold winter season could potentially cause a spike. Choi Min-jung, Arirang News.